Hello, everyone. Welcome back to week 4 of our Backyard Poultry webinar on viral respiratory diseases. This week, we're going to be tackling the topic of diagnostics and the Veterinary Diagnostic Laboratory. So if you saw last week's webinar, you know all about me already. To recap, I grew up in Little Falls, had backyard poultry. I'm forever a student, and I work at the Veterinary Diagnostic Laboratory. Our weekly disclaimer, these webinars are for educational purposes only. We will not diagnose any disease or prescribe any treatment for individual birds or flocks. Please contact your veterinarian for questions on specific disease, diagnosis, and treatment. These are my objectives for this presentation, and I'll go over them in a little more detail on the next slide. So first, we're going to be doing a quick overview of definitions and why diagnostics are important. And then, and get excited for this, we're going to have an exclusive interview with Dr. Rob Porter, our poultry pathologist here at the University of Minnesota Veterinary Diagnostic Lab. And last, we'll look at a quick video of how to submit a sample to the Veterinary Diagnostic Lab. All right, let's jump into diagnostics. First, let's make sure we're all on the same page with a couple terms that we will use a lot in this presentation. When we're using the term diagnostics, we mean the systematic process we as veterinarians use to evaluate and test to find the cause of a disease. Think of when your computer is running diagnostics to scan for malware and viruses. For us, diagnostics can be more macro or micro. For example, a physical exam of a bird might be all we need to use for diagnostics if the problem is a cut. However, in respiratory disease, we often need more advanced testing than that. So we take samples and send them off to laboratories to look for microscopic causes like bacteria and viruses. The word necropsy is like an autopsy, but on animals, also known as a post-mortem examination, or often shortened POST. So I have a quick exercise for you all to kind of put into practice the knowledge that you have learned in the past few weeks. So match the diseases that I have listed on the left to the sick birds or the pictures on the right. And I'll give you a few seconds to kind of think this over. Okay, you ready? See if you're right. Here are the answers. Okay, it's a trick question. On each picture, I listed several diseases, including some we haven't even talked about, that could be the result of the clinical sign that is shown. This illustrates a really important point in poultry medicine, which is it's very, very difficult to diagnose a disease just by looking at the birds. Further testing is needed to diagnose most poultry diseases. So where do we go for further testing? Look no further than the University of Minnesota Veterinary Diagnostic Laboratory. So the Veterinary Diagnostic Laboratory, that's a mouthful, I usually just say VDL, is located right here in St. Paul, Minnesota, right by the state fairgrounds, just about on top of them. In addition to necropsies, it houses many labs that test for a variety of viral, bacterial, fungal, parasitic, and metabolic diseases in practically any species of animal. On the next slide, we're going to have our exclusive interview with Dr. Porter. Okay. So first, Dr. Porter, can you give us a little introduction of yourself?
Okay. What a fun thing to do. My name is Rob Porter. I'm a veterinarian. I'm a veterinary pathologist at the University of Minnesota, and I specialize in diseases of birds, particularly poultry. And I also teach and conduct research in the university system. So that's what I've been doing for quite a few years.
Awesome. All right, we'll jump right in. A first question is, what can backyard poultry owners expect when they submit a sample to the VDL? Like, what is the process?
The first thing I want to do is, I can take you through this, but first thing I want to do is to refer anyone who's interested, refer them to our extension website. And it's extension.umn.edu/poultry. And there is a video that we created about, I'd say about 3 to 4 years ago, maybe 5 years ago now, and the title of this video is Testing of Sick and Deceased Birds. And it gives a very good breakdown in terms of submitting birds to the diagnostic lab, what to do with them, how to bring them in, and things of that nature. So it was very well done. So if someone is interested in doing this, I'd be the best way to do it. My recommendation is, we are used much more often, obviously, with looking at commercial birds, large flocks of birds, because we want to find out immediately what the disease condition might be so that we can make immediate recommendations on treating the flock. Now, with small flocks, your average small flock in the United States is 4 birds, because that's usually all that's permissible in urban or semi-urban or semi-rural communities. But there are some flocks that are larger than that. And I would recommend a necropsy number 1. Even if you have 4 birds, some people need peace of mind to know why a bird died. That's the basic reason for a small flock owner to have a necropsy, peace of mind. What did this bird die from? From a practical standpoint, answering that question would be, or the additional question would be, the bird that died, does it have anything, or did it die from something that would pose a risk to other birds in the flock? And to me, that's when submitting a bird comes in very handy. However, it costs money. We can't do this for free. So you're automatically, if you have a sick bird that you take to your veterinarian, or you have a bird that has died that you bring into the diagnostic lab, you're automatically looking at $100 or more to do either of those things. So you should be forewarned that it's a great idea to do it, but it's something that you need to be able to afford. So you need to think about, when you're spending money for your flock, how's the best way to spend it? You lose a bird, my immediate recommendation is take the bird, get it in, or as soon as you find it, put it in a plastic bag, put it in the refrigerator. Don't freeze it, but just keep it in the refrigerator. Then you can decide, is this a bird that I need to have diagnostics on? In other words, should I send it to our lab and have it determined whether the bird died from trauma or infectious disease, bacterial or viral or parasitic infection? So every state has a diagnostic laboratory, and you can locate that state by just getting on the email and Googling blank veterinary diagnostic lab, Minnesota veterinary diagnostic lab, Iowa veterinary diagnostic lab, South Dakota veterinary diagnostic lab. So we're very easy to find. And once you have made that contact, it's a good idea to link up with the person who is designated as the avian specialist at that laboratory. So you can do that by phone call, or maybe just by scrolling through the list of specialties on the website. And if you're insistent on wanting a necropsy, then you don't even have to hesitate. You can either bring the bird in that day. Most labs are open 8 to 4, give or take a half an hour on either side. Or if you are located many hours away from the laboratory, you can take the bird, you can wrap it in plastic, and you can put frozen gel packs around that bird, wrap it in plastic again, put it in a water-resistant container. Styrofoam containers are perfect for this. So if you raise birds, keeping a few of these water-resistant boxes around that you might have used for something else is probably a good idea. and you can ship those birds via the postal service, overnight shipping, and Fed Express, UPS. The important thing is to get overnight shipping so that in 90-degree temperatures, that the carcass does not decompose, and that in the middle of January, that the carcass doesn't freeze while you're shipping it to the laboratory. So you have a choice of shipping it in or bringing it into the lab. If you have a practicing veterinarian who works with you for your dogs, cats, pigs, cattle, whatever, they will often work with you to receive your bird and prep it and set it up to be shipped to the laboratory. And keep in mind, anything you do additionally will add to that charge. So it's not surprising that the veterinarian will have to charge you to pack up the bird and put the packs in and ship it off to us. So again, there's expense involved, but I can emphasize that there are some important answers that we can share with you. Does that answer that question, or would you like me to continue with what goes on at the laboratory?
Sure. Yeah, absolutely. That'd be great.
Okay. So when we receive your bird at the lab, we enjoy getting a history. In other words, many people think this bird was poisoned, or it has this disease, it has that disease. And that's because many of our clients now have books, they get on the web, they talk to neighbors, so they're convinced it may have a certain thing. Sometimes you're right, and sometimes you're wrong. So what I'm trying to say is I listen to your history, but I look for everything. Every diagnostic lab does that. You may think your bird has a viral disease. That doesn't stop me from looking for bacteria, for parasites, and we look for viruses as well. So you deserve to have a thorough evaluation of the carcass when it comes in. We look for everything because we want to get information that can, as I'd mentioned before, either give you peace of mind or give you some idea whether the bird has something that poses a risk to your other birds in the flock. And it usually the tests that are usually run are, we'll do bacterial cultures, we'll test the birds for virus, and there are two methods. We have molecular tests for that, and we use cell cultures for trying to grow virus as well. We look at the tissues of the bird, the lung, intestine, liver, etc., under the microscope to look for evidence of inflammation. And we can test the bird for parasites, both ectoparasites and intestinal parasites as well. So all of these tests, and to put them together in a report, can take 1 week, 2 weeks. Sometimes it takes a little longer than that. It depends on what tests we're running. So I urge you to don't hesitate to contact the pathologist at the laboratory within a couple days, and you can check in and see what they may have. Many labs like to give you a preliminary report. So I would be disappointed if you don't receive something within the first 48 hours to say, here's what we found so far, but we're still looking. And sometimes you have a diagnosis right away. Other times we have to do a little bit more work, more testing to determine with certainty what the cause of death is of that bird. And when you have a diagnosis, it certainly matters to us in terms of what can you do with that diagnosis. So for example, a very common condition in backyard flocks, especially with the most dominant hen in a small flock of 3 or 4 birds, is fatty liver disease. And to make a long story short, it's from the birds eating too much. The dominant bird, she gets most of the treats, she dominates the feeder, and because there's so many calories, so much fat accumulates in the liver, it can fracture. And she's usually the most popular bird in the flock, and she dies because she bleeds. She dies from internal bleeding. And so even though there's no infectious disease there, it's a very important thing for you to know, because you are likely contributing to this condition in your flock by what you are feeding these birds. So that's an example of when we find this, we can help you with the nutrition of these birds to try to reduce that, reduce the chance of that happening in your other 3 or 4 birds or happening in the future. So that's an example of a non-infectious condition. So further communication with either the pathologist or or a poultry specialist who works with small flocks would be very useful in that case. So it's great to have a diagnosis, but that diagnosis, I don't think it's very useful to you unless you can work with someone and get some advice from someone who can make some recommendations for the future of that flock.
Awesome. Thank you.
Mm-hmm.
I feel like you kind of answered the next question, but maybe I'll ask you just to reiterate just a bit. What can you find on necropsy that is helpful to backyard chicken owners?
Okay. There are pathologists are trained to look for abnormalities in the bird. So and to tell us what either the disease condition is or the cause of death. So for example, when there is pneumonia in the bird, inflammation of the lungs, we can tell the difference between normal lungs and what abnormal lungs look like. There are specific changes that can take place in the intestine that can tell us right away. For example, if we have, this happens all the time, we have very young birds that are infected with parasites, pullets and chicks and such. And for example, when they have a protozoal disease called coccidiosis, oftentimes the findings in the bird are very characteristic, and we can make that diagnosis just by looking at the bird. Or if the bird has intestinal worms, such as ascarids, we often find those right away in the intestine, and those can cause chronic wasting of the bird. So there are things such as that, my gosh, we just got the bird, we did a necropsy, we have that diagnosis. And that's something we can communicate to the owner immediately so that he or she can look into applying wormers or anticoccidials to that flock. Sometimes we don't see anything when we open up that bird, when we're looking for changes in the body cavity. So that's when we need to take it further. That's why we do cultures for bacteria, test for viruses, and that's why we also look at the tissues, the major organs in the body under the microscope. We call that histologic evaluation to see if we can find evidence of inflammation or disease as well. So if we don't find anything, we just have to we take one step further to see if we can come up with an answer for the owner.
Awesome. In what situations does it make sense for backyard poultry owners to send their deceased birds to the VDL, the Veterinary Diagnostic Lab, because we know it does cost money?
Okay. I often chuckle about this with backyard flock owners because we'll talk about what would be useful, and usually when anyone loses a bird, they want to know immediately what has happened, and cost is no object. And then we talk about it, and I'm honest with them, and it's not just the lab at Minnesota, but easily most diagnostic labs, when you send a bird in for necropsy, it's going to cost more than $100 to have that done. That's a ballpark figure. And so we often chuckle because the owner or the person who raises the birds will usually say, okay, I really would like to do this, but I'm going to have to talk to my spouse because he or she is probably going to kill me if I tell them it's going to cost me $100 to have this done. So I mean that's just a conversation that we have all the time. So I don't think it's fair to push someone into having that done because I'm always honest with, sometimes we get you information that will be very useful, and particularly if, as I've mentioned before, if you're looking for peace of mind, just to know what happened, we can definitely provide that for you. But there's other times where we can provide some information that's of great value. And that's because there are some infections that you can actually vaccinate your flock for. Examples are Mycoplasma gallisepticum, which is MG of birds. It's a respiratory infection. There's also a very common respiratory virus in backyard flocks, which is infectious laryngotracheitis. And with the proper knowledge and assistance, you can vaccinate your small flock for that as well. So there are some things we can do when we find an infection that we might be able to protect your other birds. Same thing with intestinal parasites. particularly coccidiosis, we can immediately treat the rest of your flock. Mites, the scaly leg mite of birds, or feather lice. We can, if we make this diagnosis, we can help you treat the other birds in your flock. So that's where getting a diagnosis comes in very handy. And you just have to be aware that my favorite diagnosis, sometimes I find nothing. We have a bird that died and we don't know why. And that disturbs some people, but in my mind, that's the best diagnosis I can give an owner, because I can tell them the strength of what they don't have. And I'm always very happy to tell an owner and say, you have a bird here. I'm not sure why it's died. We're doing all these tests and everything's negative. So what I can tell you is that there appears to be no risk to your flock from respiratory disease or bacterial disease. I don't see any evidence of trauma. I see no evidence of nutritional problems. And it doesn't always satisfy you to know why that bird died, but I take great solace in that, because I can say, here's what I did not find in your flock. And that's very positive news for you. So even not finding something can be very valuable for maintaining the health of the rest of the birds in your flock. The only thing, again, I have to remind the owner is that we thoroughly enjoy working with small flocks, and I can name you veterinarians and pathologists at diagnostic labs all across the United States who greatly enjoy working with small flocks because of the increased numbers of these small flocks, the passion that the owners have for these small flocks, and their desire to want to get a diagnosis when they either have an illness or death loss in their flock. And so I don't think you will have any problem finding someone to do this work. And so if you do decide to cover that expense, you should be, I predict you will be satisfied with the feedback and the assistance you get with that diagnostic work. The only caveat is it's going to cost some money to have that done. Everybody thinks, oh, you just throw some feedback with the chickens and you build a nice pen for them and they do just fine. And the more you do that, you realize sometimes the expenses start to build up. And this is one of those that can occur. So it's also a great education for your children as well, that in a way, raising chickens is a form of miniature agriculture. And as part of that, animals die. And often a traumatic event, whether it's a cat or dog. Well, I've seen people who have been very broken up when it's a single chicken as well. So there's no question that having these small flocks has a great educational value for the family as well.
Yeah, I agree. I had backyard chickens growing up, and it was really good education.
Good for you. Good for you.
So what type of diagnostics does a VDL offer? I think you covered that pretty well. That we have the bacteriology and virology and histopathology, looking at things under the microscope, in addition to the anatomic, looking for pathology.
Yep.
Like at the from what the eye can see. Is there any like antemortem testing or testing for while the birds are alive?
There is expense involved. I'd say the most common form of testing of live birds is serology. So for example, you could test your bird for antibodies to Mycoplasma gallisepticum. Most flocks, if they're serologically positive, that will indicate that the bird is likely carrying that organism. So that can be useful. You can test your flocks. If you have respiratory signs in a flock, you can test them for antibodies to infectious bronchitis virus and Newcastle disease virus. So this is all serology, testing the blood of the birds to see if they're making antibodies to infectious agents. And if they're making these antibodies and they haven't been vaccinated for these viruses, that this is a strong indication that they've been challenged with these viruses in the field. The other test we can do, and I find that more of our flock owners are doing this, is to test the manure of the birds periodically. Just grab some manure either in the pen outside the coop or on the floor inside the coop, put it together and submit it, and we run a fecal float on it. And a fecal float, we look for eggs of intestinal parasites, and we also look for evidence of coccidiosis as well. And that's a really good way to monitor the parasite load in your poultry flock. And it also is a good way, kind of a quality control, to see how your worming program is going in that flock as well. So I've mentioned serology, fecal flotation. The last one would be molecular testing for respiratory viruses, and that can be done by collecting you have a Dacron tip swab that you collect from the trachea or the oral cavity, and that can be tested, and we usually place that in a carrier broth brain heart infusion, which is BHI. That can be tested for viruses such as avian influenza, Newcastle disease virus, infectious laryngotracheitis virus. I'd say those are the three most common, and we also at our lab we can also test those for several types of mycoplasma infections as well. So that's a very handy way to do surveillance of your flock. So one thing I have done, I'll often get calls about small flocks, whether it's 4 birds, 30 birds, 40 birds, that have sporadic respiratory signs in the birds. The birds are shaking their heads, they're coughing, you hear some snicks when the birds are sneezing. And either the local veterinarian or I've done this as well, can come out and I can collect, with the help of the owner, I can collect some swabs from a collection of the birds in the flock. And we pull those together into tubes, and we then test those for Newcastle disease, mycoplasma, infectious laryngotracheitis, etc. So that's a very handy way to do some surveillance on your flock when you have some birds that just aren't right. You're not ready for any of them to die. You don't want to sacrifice any. You don't want to give any of them up and have them euthanized for testing. But you'd like to have some live bird testing to see if there's anything cycling through those birds. So that's a service that some of our practitioners can work with us to provide that service for a small flock owner. So those are the 3 key tests I would say that we can provide for live birds.
That's awesome. That's really good information. I didn't know that. So very cool.
Now you do.
Now I do. As the pathologist, what do you think are important things to remember when owners are submitting their samples to the Veterinary Diagnostic Lab?
Okay, make a decision, because unfortunately, making a decision means that you're aware that you need to refrigerate the carcass as quickly as possible after the bird dies. Or if you have a bird that is sick and the condition of the bird is deteriorating, you need to make a decision in terms of what you would like done with that bird. And for those who have a bird, any bird, whether it's a pet or whether it's a bird that's part of a larger flock, just keep in mind that we do have humane methods for putting these birds down, euthanizing these birds when you bring them into the laboratory. So it can be rather challenging and nerve-wracking for some people to think about putting their own birds down. And it's a very cumbersome and awkward thing to do. So you can either have your local veterinarian do that, or if you're within driving distance, you can bring the birds in live, and we will euthanize those birds for you and provide a diagnostic workup on those birds. So the whole point that I was making there, you have to be committed to doing this, because you've got if a bird dies, you have to get it refrigerated as soon as possible. And once it's refrigerated, things still, we all know that we keep things in the refrigerator, and fresh food still deteriorates. And that's going to happen with that carcass that's in the refrigerator. So we really would ask that you make a decision on whether to necropsy that bird within 48 hours after that bird dies. And if you haven't decided what to do yet, wrap it up, get it in the refrigerator anyway, cool it off, don't freeze it. And while you're thinking about whether to bring it in, at least we know that the decomposition of the carcass is slowing down, so that it'll be ready for us, appropriate for us when we do a diagnostic workup.
Awesome.
And if you don't know what to do, if you're not sure if you want to spend money, if you're kind of caught in between, not knowing to go in one direction or another, we love to talk to people. Give us a call. You can talk to extension personnel at the University of Minnesota on the poultry side, or you can call the Veterinary Diagnostic Lab and ask to speak with a poultry specialist. We have one at the Diagnostic Laboratory in St. Paul. We also have our sister laboratory in Wilmer, the Minnesota Poultry Testing Lab, which has several veterinarians there as well. And we love the public, and we like talking to people, and we have no issues with spending some time talking to you about what problem you're dealing with, and maybe helping you make a decision on what to do with that carcass, or what to do with that flock.
Fantastic. Do you have anything else that you'd like to share regarding backyard poultry and VDL?
I do. One big key, my advice is, if you own backyard poultry, or if you have small flocks, particularly that you're raising as pets, do your best to check and see if those birds can be vaccinated for Marek's disease at the hatchery. Marek's disease, it's a herpes virus. It's a viral disease that can cause paralysis in chickens, and it also can cause tumors inside the body. And there's really only one way to reduce it or prevent it, and that's through a vaccination, which has to take place within 24 hours of that bird hatching, because the virus is so ubiquitous or so common in the environment. As soon as those birds are placed in the brooder environment on your premise or in your coop or whatever, they're going to be exposed to this virus. So that's why we need to protect them within the first 3 days after hatch. People get very close to these chickens, they become pets, and unfortunately, by the time they're 4 to 5 months, sometimes these birds can develop paralysis and tumors. And then they find out that if they had vaccinated, they could have reduced the chance of this happening. And so, of course, they take it personally and they blame themselves. And that's not the case. It's just becoming educated on the right things to do. And if you're dealing with a small flock hatchery that doesn't vaccinate, see if you can find another one that does. And if you're dealing with some of the mail order catalogs and things of that nature, there's usually an opportunity to have those birds vaccinated. And trust me, it's worth the extra $1.50, $2 or more to have that chick vaccinated. You could save yourself some misery in the future. That's my big going away comment. Great.
Thank you so much. I learned a lot, and I'm sure everyone watching this webinar will learn a lot as well. And I think we all feel more prepared to know what we're getting ourselves into at the Veterinary Diagnostic Lab. So
enjoy your birds.
All right.
Okay.
Whoops. Okay. So lastly, we're going to watch a quick video on how to submit a sample to the VDL.
Whether you raise poultry as a hobby or for commercial purposes, you will on occasion lose a few birds. Birds can die for many reasons, so some death loss is to be expected. However, if frequency or numbers are increasing, then you may want to have the birds necropsied at the Veterinary Diagnostic Laboratory to discover the source of the problem. Sick birds can also be brought to the lab, but they will be euthanized for testing purposes. In fact, there are a few diseases of poultry that, if discovered in a flock, need to be reported to the Minnesota Board of Animal Health. Highly pathogenic avian influenza is one of those. To test your bird, place it in a sturdy plastic bag and cool it in a refrigerator or an iced cooler as quickly as possible. Do not freeze the bird. It is very important to get the flock tested in order to control the spread of any highly contagious disease. The Veterinary Diagnostic Laboratory is located at 1333 Gortner Avenue on the St. Paul campus of the University of Minnesota. Short-term parking for drop-off of diagnostic specimens is available just outside the laboratory. There are a few forms to fill out with the submission of your bird. They include information about the name and address of the farm, name of owner, phone number and email contact information, the U.S. premise ID, type of birds, age, sex, and number of birds in the flock. List any clinical signs and how many birds have died. Bring a copy of production records to give to the diagnostician if possible. You can complete the diagnostic Necropsy submission form prior to your arrival by consulting the VDL website. The clinicians at the laboratory will do the necessary testing to determine the cause of death for the bird. Owners or veterinarians will be notified of urgent preliminary findings on the necropsy as quickly as possible and are further updated on test results as they are completed. Completion of a full report can take up to 2 weeks. All types of animals can be tested at the University of Minnesota Veterinary Diagnostic Laboratory. For specific information, please call 800-605-8787.
All right, and that is the whole presentation. Thank you so much. And as always, feel free to email me if you have any questions. Thank you.